and I want to tell you just a couple cases that we've had here. Of course, I've mixed all of the information to protect confidentiality, and then I want to describe to you how I do the testing. So the first thing I would like to say is when I started here at Alta Mira, it was last fall, and one of the most wonderful things was Bill came to me and said, you know, we want you to do whatever tests you would like to do. And it was like, oh my God, this is so exciting. Because over the years, I've really developed a battery that if you talk to any other psychologist or neuropsychologist, it's the standard battery. It's a group of cognitive tests, which means testing for memory and verbal, visual ability, working memory, processing speed, and also psychological tests. So the first thing that I wanted to say is, I wanted to just describe the overview, then I want to tell you a couple of case studies, and then I want to tell you step by step how we find these things out. So the first part of this is we call it a psychological or a neuropsychological assessment. The only difference between psychological and neuropsych is with neuropsych, you always do the psychological first. And if you see some things on the cognitive that looks like there might be a brain problem, then you go ahead kind of down that road. It's like a red flag, and you'll go and do more neuropsych testing, like what's called the Halsted-Reitan battery or the Luria. But what we're going to talk about today is just the pure psychological battery. It still includes cognitive, but it covers about 99% of our clients. There's only maybe 1 or 2% we've gotten in that's needed the neuropsych. But when they do, we go ahead and do it. So what I do first is I will meet with the client and we'll sit down, and it's really an amazing mystery. You know, it's like a Hercule Poirot or a Miss Marple. You know, we'll sit down, and what I'm looking for is to figure out the mystery of the person. What's going on? What made them decide to use drugs and alcohol? And of course, as you know, most people that are addicts, you know, there's a biological predisposition, but there's other factors that make them start using, and what are those factors, and what makes them keep using, and what can we do to figure out what's fueling them so that we can help them change and stop using. And so in addition to all of the therapy and the spiritual interventions and everything that we use here, one of the first things that we try to do when somebody comes in is to do the psychological testing. It's a little bit difficult because we can't test immediately. People are in detox, they feel awful, and probably the way that they test doesn't really represent them. So we usually wait about a week, but since we only usually have about a month, we try to do the testing after 1 week. Sometimes I've had to wait longer, sometimes we're able to do it within a day or two. So the first thing I'll do is sit down with the person and ask them all about themselves. I really want to know everything. I want to know where they went to grammar school. I want to know what they like. I want to know if they have animals. I want to know if they're married or not, and what kind of things they like to do, and when they first started using. So after the clinical interview, then what I do is the cognitive testing. And for all the people that we have here are adults. So we use the Wechsler Adult Intelligence Scale, called the Weiss. It's the 4th edition now. And what we do with the Weiss is verbal comprehension, perceptual reasoning, working memory, and processing speed. And the first part, verbal comprehension, we'll sit down after the clinical interview, and then I'll ask them a group of questions about how things are similar, like, you know, how they're alike, like how are a lion and a tiger similar? You know, they're both animals, that kind of thing. And it gets much, much more difficult. Like, what are the similarities between peace and war, and those kind of more abstract questions. And then we'll go to vocabulary, and I'll give them a list of vocabulary words, and they define them to me. And then we'll go to information, which is general, all kinds of general information. You know, on what continent is a certain country, what is the capital of another country, who is president, you know, those kind of general information, what temperature does water boil, all kinds of things. And then on the next thing, the next part of the testing, we'll do perceptual reasoning, which is visual tests, and we'll do block design, matrix reasoning, and visual puzzles. And this is kind of a good point right now to talk about one of the first cases that I worked on. And one of the very first cases, which is very interesting, it was a woman who was having painkiller issue. She came in addicted to painkillers. She was drinking a lot of alcohol. Her medical doctor, who was the head of rheumatology at a very famous hospital in Los Angeles, I'm changing all the exact information for confidential reasons, but had sent her here because she was addicted to painkillers and alcohol. But the reason that she was addicted, she said, is because she had so much terrible pain. And when I asked her to describe the pain, she said it was like somebody was taking a rolling pin and rolling it over her head, and it had needles in the rolling pin, and she just felt pain all the time. The doctor, she was a middle-aged Caucasian woman, and the doctor, who was an older man, thought that he described her as hysterical, but he also thought that she was psychotic. And before she came to us, she'd been in a psychiatric unit. And they had not been able to find out what was causing this pain, and so everyone thought that it was psychiatric. So then I sat down with her, and we did all of these different tests. So we started out with the verbal tests, and then we went to some of the visual tests. And so we did the first visual test, block design. That's just one example. I give the people, the clients, a group of 4 blocks, and then by the time we get to this one, it's 9 blocks. And then they have to use the blocks, each one of which are red and white, to make these designs. And they have to put them together as quickly as possible. And so when she was doing this, she had a terrible time. She couldn't get the gestalt, and she couldn't put the blocks together. Then we did this one called matrix reasoning, where you have a pattern, and then you look down here, and she wasn't able to figure out which one belongs here. The colors you can't see so well on this, but those are dark green and blue and then yellow and red. And she really had trouble figuring it out. So I began to feel that something was going on that was neurological. Then we went to visual puzzles, and the job here is to pick out 3 different pieces that together will make that picture at the top. And I know this is really a little hard to see, but if you pick out 1, 3, and 4. You put 1 and 4 together, you flip them, and then put the 3 like this, and that's what is the answer. But she had a really hard time figuring that out. So I really began to see that she had so much trouble visually, and I began wondering if something was wrong with her brain, with the visual cortex. So then we started to do the psychological testing with her, and this is what I do with everyone. I do the Beck Depression Inventory, the Beck Anxiety Inventory, and those are just 21 questions asking the person about their symptoms of depression. And the anxiety is the same, but with their symptoms of anxiety. And then the MMPI is probably everybody's familiar with that. That's what most of the recovery centers use, is the MMPI, and maybe the BDI and the BAI. They kind of use those 3. That's about it. They usually don't do much more. So we're just really lucky here. There are some other places, but we're really lucky in that we're able to do all of these different testing. So on the psychological tests, I didn't see any psychosis. The doctor was saying, I think she's psychotic, because she's having this pain and we can't figure it out. And then on all of the visual testing, like I said, she just couldn't even put the blocks together. So when she was describing her symptoms, I decided to send her over to a laboratory and have a double-strand test run for different illnesses, including a test for lupus. And the test for lupus came back just off the ceiling. Just off the charts. She had a severe case of lupus. And this doctor, who was a rheumatologist, who was the head of the rheumatology department at a very famous hospital, had not figured this out. She had a history of rheumatoid arthritis, so she's already got a kind of an autoimmune disorder. So what happened is we got her put on methotrexate, and within 3 weeks she was completely normal and no pain at all. And if the testing hadn't been done, what she was looking at was the rest of her life in institutions. So that was one case that was particularly compelling about how the testing can really change someone. Then there was another case where there was, a young man who came in and was absolutely brilliant and was just acing all of the cognitive tests and acing everything, and definitely no neurological problems. But then on the psychological tests, we started to have some problems. So what we do on the psychological testing, like the first 3 are self-report, and then we get into the projective drawings. So I asked him to draw, so one of these are not done by actual clients, but I have quasi-copied some of the different ones that I've received over the years. And the first thing I do is I ask people to draw a house, then I ask them to draw a tree, and then I ask them to draw a person. And so what this person did is he drew this kind of a house. It was just tiny. It was about at 1/100th of the page. But then he drew a lot of bizarre things around it, like bats and, demons and just wild stuff. And to him, that was this house, and it looked kind of really crazy. And so in other, with other people, this is kind of what you're more looking for. You're looking for a house with windows, curtains, chimney, door, path. A lot of times with people that have post-traumatic stress disorder, what will happen is they'll want to protect themselves, so there won't be a door. Or it's almost the opposite. There'll be an open door, and there'll be windows with no curtains because the person feels so violated and so, broken into. So with this boy, he drew this tiny, tiny house with all these bizarre things. And then on the tree, his tree was like the top tree, which is a very depressed tree. I mean, there's just sticks. There's no leaves. There's no ground. But again, he drew like bats and bizarre things and splashes of color. He has to use color. And then that middle tree is the kind of tree I've seen a lot with people that have post-traumatic stress disorder. There's openings, there's like representing orifices that have been violated. There's projections representing the perpetrators having violated them. And on the bottom tree, that's a slightly more, normal tree, quasi-normal. There's ground. We always look for ground, and if there's shading or no shading. And then what happened is people, and he drew kind of the top with just a face, but again, there were kind of pinwheels and spirals going off and animals coming off from it. It was really wild. And so it turned out, after all the testing, we then did the Rorschach and the TAT, which I'll get to in a second. But with the TAT and the Rorschach, the TAT is a group of pictures, actual pictures. If they see a card with bright colors, and if you're psychotic, it really pushes you, and it can really trigger you. And so he saw that as demons. People that are psychotic usually are so terrified by the voices and what they hear and what's going on in their heads that they have to kind of try to externalize it. And he saw that particular card as 2 demons bleeding, coming out from space to get him. And so, this poor kid. Anyway, so after all of the testing, unfortunately, it did turn out that he was schizophrenic. But at least we knew. And so we were able to get him to a psychiatrist. He had never been on medication before. And then he started to use antipsychotic medication. And the difference was amazing. He was able to function. He was not like trapped in the prison of his psychosis anymore. And it was really incredible. And that was what was driving him to use drugs and alcohol, because he was so tormented. And then we had another, one of our more normal cases, where someone comes in and they were very, very depressed, and they were using a lot of drugs, and mostly alcohol. Alcohol was their particular drug of choice. And so when we did the testing, what happened is they looked very normal on the cognitive, but on some of those tasks on the cognitive are timed. The block design is timed, and there's one called processing speed, where you write things down as quickly as you can, and that's timed. So on all the time tests, she was very slow, but on everything else, she was very high. And it turned out that as she was talking, and the daily groups helped her so much, and she specifically bonded with our spiritual director here, TJ, who really helped talk with her almost every day. And she talked with her primary counselor. And it turned out that her father had sexually molested her, and she had never told anybody, ever. and she was drinking to just try to block it out. But it really came up on the Rorschach, because you really see the post-traumatic stress disorder and you really see the sexual abuse. And once it came out, it was like this tremendous burden had been lifted from her, and she just started to look so much lighter. And she stayed for only about maybe 6 or 7 weeks, but the difference was incredible. It was absolutely amazing. And so that was another case of where the testing can really help save somebody's life and prevent them from committing suicide, because they're driven to that. And then one of the other normal cases that we got, but was fascinating, was a young man from the East Coast and extremely involved in politics. And he was also very depressed, but he had been failing. He had been filling out at every single job, but when you look at it, you'd think, oh, that's because he's using cocaine and he's using meth. But then when we did the testing, he was so bright, but he was bright on all of the verbal, and then he couldn't do the visual, like my woman with the lupus, but it was a different flavor. Like, he could do it, but it was slow. Make a long story short, it turned out he had a nonverbal learning disorder that was extremely severe. It was a receptive auditory processing deficit is what it was specifically. So we sent him to a special speech pathologist, and he went through a program called Fast Forward, and it totally changed his life. All of a sudden, he could sit in board meetings, and he could hear and understand everything. Prior to that, he could hear perfectly well. That's why all the hearing tests and all the medical tests were normal. But he couldn't process what he heard. But it's the invisible learning disorder. It doesn't get picked up unless you're tested by a neuropsychologist or speech pathologist. And why would he be? Because he speaks perfectly normally. But this is when he was like 35 and had been hidden for 30 years. And he had just, bombed in school and done really badly after 6th grade, because at the profile with those people is at 6th grade it starts to get really bad, because the lectures get longer and you don't use so many pictures. And so when this was found out, he went and he got help, and he did the Fast Forward program with a speech pathologist, and now he is so happy and he's doing so well, and he's sober. Because so many of these people, they absolutely have the biological vulnerability to addiction, yes, but there are other reasons why they continue to use and what fuels them and drives them to use. So the testing, like Bill said, does help. We really see tremendous difference, like the cases I mentioned, in about 30 to 40% of the cases, but we see moderate difference in about another 40%. In about 20% we see mild difference, but in 80% there's moderate to huge differences as a result of the testing. And as I find out what's going on in the testing, I write up the report as quickly as I can, and then we talk about it at rounds. We have rounds every day. We call it pass down. And then we discuss it, like, what can we do? How can we help this person? What is the diagnosis? One of the most important things in treatment, I'd have to say the most important, is diagnosis. If you don't have the right diagnosis, how can you treat the person? If you liken it to a medical situation, if somebody has lupus and you don't know what it is, how can you treat it? You can't treat it. You don't know what it is. You can't give them the right medicine. And so with this kind of difficulty, which is psychological or it can be physical, we need to figure out what is going on so that we can treat it and we can help the person, and it can make a tremendous difference. And so I did want to ask, actually, if anybody has questions, because I think we have about another 5 minutes left for questions. If there are any questions about any of the testing, or about the testing itself, or about how we do the testing. We do give the testing to every single person that comes in. I think in the last 9 months I've had one person that didn't want to do the testing, but then they later decided they did when they heard about it from other people. But if somebody doesn't want to, of course they don't have to. We don't shove it down their throats. But it's just been so helpful to me to figure out what's going on. Yes.
Yeah. How long does the testing take?
Oh, excellent question.
Hours?
It takes about 6 hours altogether. I think it's way too exhausting to do it in one sitting. It's too exhausting for me, at least. So we break it apart into 3 sessions. I usually meet with everybody 3 days to 4 days, and I usually skip a day in between sometimes. I do the clinical interview first for an hour, and then I usually try to do the reason we do the cognitive first is it's the least provocative and the least triggering. You know, the blocks and this and that. We get into the psychological the second day, but I usually give them 1 day to kind of rest in between.
How much?
And then how much?
Yeah, if say a community person wanted to do this.
Oh, if you're talking about how much does it cost in a normal setting, most neuropsychologists charge between about $2,000 and $3,000 for a full battery like that.
Okay.
Other people charge a little bit less by the hour. You know, they can charge like $150 an hour, you know, kind of the standard therapy rate. It takes about 4 to 6 hours to do the battery I'm describing, which is a moderate battery, and it would take me about 3 hours to score it. I've been doing this so long, I go really fast. It would take somebody else 6 hours, I can do it in 3. It would take somebody else about 8 hours to write up the report, I do it in 5, you know. So it takes a total of about 14 hours per person. And then the feedback hour is very important. We don't let anybody get out of here without feedback, and we give them the feedback as soon as possible, and we do it with their primary therapist in the room if they want. Because I've talked to so many people that did these tests at school or at other recovery centers, and they never got feedback. I'm not kidding you. They never got feedback. When I was learning this, I was given the tests. It was part of my schooling. I was never given feedback. And now I can't go back and do the tests because I know them too well. So, you know, but I never got feedback. I don't know if I'm crazy this whole time. Probably. So, but I, you know, as Bill also said, you know, I also do speak French, Spanish, Italian. I speak Hindi and Urdu. I lived in India and Afghanistan for 1.5 years, and Iran. I speak some Farsi. I'm learning Arabic, and I also, so I do testing in Spanish and in French, and I also just finished testing a woman from Mongolia, and I speak a little Mongolian, so I was able to at least do some of the testing in Mongolian. And I also just tested a man in Hindi who had dementia from UCSF. These tests are not available in Hindi, but you can do all of the visual, and you can do the Rorschach and the TAT in Hindi, of course.
And the testing is all-inclusive here.
Yeah,
Alta Mira.
there's no extra charge. Right, exactly. Yes?
First of all, I'm very impressed with your knowledge and your enthusiasm.
Oh, thank you.
Wonderful. Do you take private?
Yes, I do.
How does somebody out there go about finding a good neuropsych or psychologist to do testing?
You actually just look, I mean, if you look up on Google, there's only about 10 of us in San Francisco who are neuropsychologists.
You're in San Francisco.
Yeah, I'm in San Francisco, but, you know, I grew up in Sausalito here. And so, you know, I can always give any of you the list of the neuropsychologists who I think are really good. I've worked at Juvenile Hall for 6 years, and there's 4 neuropsychologists I work with there who are excellent. And there's not a whole bunch of them, because most people that go and get their Ph.D. love therapy. They love working with the patients, which is wonderful. They learn a little bit about testing, but not a lot, you know. So people that decide to devote their life to testing are a little unusual, shall we say? Yes. You know.
Is your card up there?
Well, we can get it through Bill. Yeah, thanks. And yes.
A person I'm sponsoring has said they had testing down south, UCLA, so I'm assuming it might be similar. But she said she was using.
Right.
So how does that affect the test or the result? Of course, she doesn't know anything about
Do you know which drug was she using? Alcohol, or do you know what she was using?
alcohol, but also meth.
Okay. Wow, that's a great combo. Okay. Okay.
I mean,
What would happen?
Whether she was using it both right then, I don't know.
If she was using it that day, I can actually tell you what, of course we try to have people not using, but if somebody was on meth, the speed with which they would do the block design is shocking. Wow. I mean, we have we've had a meth head here recently who, wow, you know, it was the block design. I was like, whoa, you know, I couldn't even turn the pages fast enough. Oh my God, but it was wrong, but it was fast. And then what the alcohol will do is it's a depressant, so they'll see everything dark. So like that picture of the girl like this with the what gun? Oh, it not only is it a gun, but she already killed herself, and there's no help, and she's not going to live, and she left 5 children that are dying and starving in the next room, and so that's what happens when you take it and you're drunk, usually.
Exaggerate.
No, I am not exaggerating at all. I mean, it's exaggerated, right? It's exaggerated, yes, because I have actually tested kids in juvenile hall that came in and they were still, it was within the 72 hours since they'd been arrested, and they were so high. And it was like, and they had to for court. They were going to court tomorrow, and we had to do this. And so even though I tell the judge, please take this with a grain of salt, we can get some good information, but so much of it is exaggerated. And the other trouble with the meth is they usually are jumping up and running around the table, and I'm running after them trying to pin them down. So I've had to do that in juvenile hall. I have had to do testing on a basketball court where the kid would be running around with the basketball because he couldn't stand still, and I'm asking him, and who wrote Alice in Wonderland? Yeah, right, So it's just like, anyway, it's interesting, I must say. So I think it really is so helpful for recovery centers. I don't think it's been explored enough as part of the treatment and recovery centers. And I'm so glad that we're doing it here. And I just have seen how much of a difference it can really make in dictating the treatment in the recovery center. It really helps us. And since we certainly here, and I think most places, work in a team. And most places have pass down and rounds. And it really helps inform the therapist. What should we do next? And with this person who is schizophrenic, this is a serious situation. I mean, he was suicidal. There's something on the Rorschach called a suicide potential index. It's not often positive. There are 12 factors on it. When you get 8 factors or more, it's a positive. It doesn't mean they're going to go and jump off the bridge, but it does mean that they have a lot in common with other people who have committed or have tried to commit suicide. And everything has to go on high alert. And when we've gotten a positive suicide potential index, I call everybody immediately, and everything's put on high alert, and we even do like kind of a one-on-one for a while. It's very important. Yes?
Have you ever had the opportunity to test somebody, say, in the first month of their getting sober, and then to retest them a year later?
Yes. Yes.
Is there a big difference?
Not a big difference, interestingly enough, not a big difference, but a really amazing kind of underneath, like you see the stability. Say the person is mentally stable to begin with, they're fairly healthy. You see that stability has just like kind of concretized almost, the person has gotten more fundamentally stable. But I have done amazing follow-ups where I had somebody, I know this sounds really weird, but it was a UCSF project. Somebody had severe food allergies, and when they would eat chocolate, they would go a little crazy. Some allergists disagree. They feel that the brain can't be a target organ, but my father, who's a psychoanalyst, he used to be a neurologist, and he did a tremendous amount of work and research and published papers on food allergies because my sister and a lot of our family have severe food allergies. And so this particular person, specifically on purpose, was ordered by the doctor to like eat chocolate. It was done in a hospital setting, got very ill. I tested her. She looked completely psychotic. And then we did it after she'd been on the diet free of the chocolate and the dairy products and citric acid. And this is actually about to be published because then it was a really amazing, and it was like a 6 months difference, and it was just incredible. And she looked psychotic one way and not psychotic the other. It was really incredible. So it's also incredible how the substances, though, it's a little bit different because when they come here, they have been sober for at least a week, usually. But there will be a difference. The other difference that there'll be is that the speed will go up, the processing speed and the block, it will go up because they are more together and they're feeling better. Exactly. They're more cognitively intact. Yes?
How about gluten allergies? Seems to be a new issue now.
Yes.
Why is it a new issue?
It's always existed. In World War II, what happened was in Holland, when the Germans invaded, the Dutch used to always have, gluten and bread, and there was a certain level of psychosis in the population. And then during World War II, all of the bread was disappeared. There was no gluten, and the level, it's amazing research, the level of the psychosis and the depression went down. They reintroduced bread in 1945 46 after the war, and it went up again. So it's been around for hundreds of years, but there's not been much work done on it. It's like, to me, it's like Asperger's or autism. It's always existed, but now we're more aware of it.
Okay.
Yeah.
Can you talk, Patty, about a lot of centers do like abbreviated versions of the MMPI and I think the MCMI,
Yeah.
and how that has a tendency to exaggerate the pathology?
Yeah, that is one thing that I do have problems with, is that when we see people coming from other centers, often they'll have the psych testing come with them. And when I first came in, the testing is usually, and absolutely not in all places, but in some places, testing's like 3 pages long. They're even making mistakes and calling she a he. You can tell it's like cut and paste all over the place. And it's the MMPI and the MCMI. Those are self-report measures. The MCMI in specific, the reason I don't use it is it looks for pathology. It wants to pathologize everybody. And I don't like it at all. And then the MMPI, I don't like that much, but I use it because it's an additional source of information, but it's only true and false. So that's it. You can't say 0, 1, 2, or 3. It's true and false. So you've got 338 questions on the revised format, 576 on the long. And, it just can tend to make people look much more ill than they are. The projectives are what really tells about someone. The projectives are the closest, which I mean by that is the TAT and the Rorschach and the drawings. They tell more about a person, and the incomplete phrases also. Those 4 tell more about a person than anything else. And when you do just the MMPI, it can make somebody look really bad. They do that in the FBI. And, when you're looking for an officer position, they give you the MMPI. And for police officers, that's what they give. And it can really make somebody look bad. If they're too honest, they'll look pathological, actually. I mean, seriously. Because it'll say things like, I like Mechanics Magazine is number 1. I have a good appetite, true or false. But if you're not feeling well that day, and maybe you don't have a good appetite, maybe you've had a headache, or maybe you just had an illness, but it doesn't allow for actual physical illness, which is crazy. Somebody just had a skiing accident, they're all banged up, and they have stomach aches and headaches. On the somaticization index, Zoom, and they're really ill. So you have to know all about the person. You have to use it as one of maybe 9 or 10 measures. If you use it alone, you're in for a lot of trouble, And so that's why I really disagree with the other places that use such abbreviated testing batteries. It's just not a good idea. And then we have had a couple people here with severe alcoholism and end-stage liver disease. And so I will give the neuropsychological, where they do the whole neuropsych thing, where you do, grip strength and you do finger tapping. But I'll tell you something. I did one of these cases. It wasn't here. It was somewhere else a few years ago. And this woman, I just had the feeling something was wrong. Everything looked normal. Then we did the finger tapping. So, I had, by that time, done like 38 tests. This was the 39th test. I did the finger tapping, and the right was so much different than the left, but she's right-handed. It shouldn't have been lower. You should do about 44 finger taps in 10 seconds. She did about 5. I sent her immediately to a neurologist. Guess what? She had a brain tumor. So they found it, and they removed it, and she's alive today. And that was from finger tapping. It's like...
Yeah, I was curious about kinesthetic testing. So you were just saying the finger taps.
Yeah.
Are there other types of kinesthetic testing?
Yeah, there's one where you have a little peg, and there's the little holes, and you do the placement of the pegs into the holes.
Okay.
There's a whole group of them in what's called Luria, Nebraska, and where you write a clock, you draw a clock, and you do all kinds of things. That's into the neuropsych, because there are definitely people. Then you also get people that have right-left differentiation problems.